And without any further delay, it's our honor to gladly present to you the first session in this conference, Future Directions in Nutrition Practice. Part 1, Obesity Management, What's New? First, let's thank the chairpersons of our opening. And let's welcome the chairpersons for the first part, Professor Dua Ganina, Professor Nawal Abdurrahim, Professor Samir Naem Assaad, and Professor Mohammed Zidan. And now let's welcome our first lecture, Obesity to do or not to D or not to D, with Professor Samir Naem Assaad.
Madam Chair Lady, Mr. Chairman, it is always a pleasure to be here. It's not my first time, and I hope, inshallah, it won't be the last, inshallah. It's always to share and with you. And I should be thankful to Professor Nawal Abdurrahim, or Professor Dr. Dua Ganina, thank you very much, as well as the Dynamo, Dr. Nelly Shams, for her invitation. I will be speaking this morning about obesity, to D or not to D. Of course, nobody will dare to mimic William Shakespeare. William Shakespeare in Hamlet, Act 3, Scene 1, he did mention to be or not to be. That is the question. And I hope I'll be able to try to answer for obesity to D or not to D. As you remember from the medical school, that vitamin D3 is produced by the skin, by ultraviolet ray and sun exposure. And the vitamin D circulates in the body. It goes to the liver to be activated in the 25 position, and then goes to the liver to be activated at 125. And the main action of vitamin D actually is to support the bone and the muscles. So vitamin D actually is not a vitamin, because vitamin by definition is not produced by the body. But vitamin D is a hormone, because it is produced in the body to one site, circulates in the blood, and goes to another organ to act. So it is actually a hormone, not a vitamin. This is the classic teaching, but recently the vitamin D has got extraskeletal action. So it can affect the immune milieu, as we have nicely heard from our Professor Nawal Abdurrahim, about inflammation. It does reduce inflammation. It can protect, I'm not sure, maybe about cancer or cardiovascular disease, and these extraskeletal manifestations are now considered of utmost importance. So vitamin D deficiency is associated with obesity. So there are several reports that obese patients, they do have vitamin D deficiency. And in our humble study, which we presented in Chicago 4 years ago, that patient with metabolic syndrome and visceral obesity, they did have vitamin D. And we did show that patient with metabolic syndrome, only 1/4 are vitamin D sufficient. And strange enough, in the normal control, only 50% of the normal control in Alexandria, they did have normal vitamin D level. In China as well, they did show the same results. So you can see that these are patients with metabolic syndrome compared to patients with no metabolic syndrome, the level of vitamin D was much lower. Also in kids, they do have vitamin D deficient if they are overweight and obese. And it seems that these are the figures, almost 50% of severely obese are severely obese kids, although they should be active, more active than us. But despite of that, they do have vitamin deficiency. And it seems that not all types of obesity are associated with vitamin D deficiency. It's particularly the visceral type of obesity. And you can see from our data, this is the waist circumference as an index of visceral obesity, and this is the vitamin D. And you can see that the lower the vitamin D, the higher is the visceral fat. So increased visceral fat is associated with low vitamin D. In Malaysia, also they did have the same observation that centrally obese persons are more vitamin D deficient. And they added that the gender base, it was more in women, and it was more in dark races. And this might be because of the pigmentation of the skin will diminish exposure to sun and vitamin D synthesis. Now, this is only few data, but if you go to the literature, definitely obesity associated with vitamin D. So there are two questions to answer. Is obesity responsible for vitamin D deficiency or the reverse? Can vitamin D deficiency lead to obesity? So I will try in the next 10 minutes just to answer this question. Firstly, can obesity lead to vitamin D deficiency? There have been several mechanisms why obesity per se can lead to vitamin D deficiency. The first one is that there is dilution of the vitamin D being fat soluble, dilution in the fat. This is increased adipose tissue uptake and also altered vitamin D metabolism. As I will show you the data now, that vitamin D is badly metabolized in the presence of obesity. Moreover, maybe the obese person are underactive, they are not exposed to sun, maybe they are not having the proper dairy products. And this interesting study, which was published in the American Journal of Clinical Nutrition, they brought obese person and they exposed them to ultraviolet light. And this is a non-obese, you get a very good response of vitamin D, while in the obese, despite being exposed to the same quantity, same time, they did not have a good response. So this means that even obese person, when they're exposed to sun, they will not produce enough. Moreover, in the same study, they did show another interesting observation, that if you give them oral vitamin D, as you can see that in the black circles, these are the healthy, while in the empty circles, these are the obese. And if you give the same amount of vitamin D orally, the level of vitamin D will be lower in the obese. And this is very important observation for us, because if you are trying to treat vitamin D in obesity, you have to give a higher dose. And the explanation is that maybe the absorption is less, maybe the metabolism of vitamin D is less. So definitely vitamin D deficiency can be due to obesity, and I've shown some mechanisms. Let's try to answer the other question. Can vitamin D deficiency lead to obesity? I will lead to this interesting observation. This was 2 years ago in the European Journal of Nutrition. They concluded that patients with vitamin D deficiency, the resting metabolic rate was less. So they are burning calories less. Moreover, in vitro studies, which they brought fat cells in vitro, and they added vitamin D. Here they added vitamin D. And you can see that by adding vitamin D, the fat deposition was less. This is the oil red stain. And you can see if you increase the vitamin D cells, this is no vitamin D. And these are the tissues with high concentration of vitamin D. the fat droplets were less. And in the same study, they measured all the enzymes, all the complicated, maybe for me, but for Professor Edin it's not complicated. All the enzymes responsible for lipogenesis are diminished by giving vitamin D in vitro. Moreover, vitamin D also, it does reduce the insulin resistance. So in this paper, in the Indian Journal of Clinical Biochemistry, they showed that the HOMA-IR as an index of insulin resistance is high in patients with low vitamin D. And in our same study, we did show that by measuring adiponectin, you remember adiponectin is a hormone produced by the fat and is responsible for improving insulin sensitivity, So we did show that the higher the vitamin D level, the higher of adiponectin level means better insulin sensitivity. And most recently, this month, April 2018, a study showed that giving vitamin D will improve insulin sensitivity. And this is a placebo. This is patient taking vitamin D. It did improve insulin resistance, whether they were obese or non-obese, even whether they were diabetic or non-diabetic. So it's very interesting observation that vitamin D is improving insulin sensitivity. Vitamin D obesity, we have to talk about atherosclerosis, because one of the nightmares of obesity is having MI or any peripheral arterial disease. This is a nightmare. So it seems that low vitamin D can induce atherosclerosis. The pathogenesis, don't be alarmed by this slide, but it has been postulated that vitamin D will increase the parathormone, and this will induce insulin resistance and insulin insufficiency. And also it increases the inflammation. We have just heard from Professor Noel about important role of inflammation, and vitamin D deficiency will increase the inflammation, will increase the renin-angiotensin system, and this will accelerate the atherosclerosis. This was more confirmed by in vitro studies. These are the foam cells. You remember the foam cells present in the atheroma in the heart? So they did show that patient with diabetes with no vitamin D, the foam cells were large. By putting vitamin D in vitro, the foam cells were less. So it seems that by putting vitamin D, it decreases the atheroma. And the more direct evidence, we have shown it in our study, by measuring what we call the carotid intima thickness, which is a surrogate marker for atherosclerosis. And we did show in our study that patients with metabolic syndrome, they do have higher intima thickness. And moreover, this was related to vitamin D deficiency. So the lower the vitamin D, the higher the intima thickness. So this means that vitamin D deficiency can be associated with atherosclerosis. Moreover, we have shown that endothelin, which is a hormone produced by the intima, this endothelin is responsible for vasoconstriction and high blood pressure. So endothelin was high in patients with lower vitamin D. And again, as I showed you, adiponectin is higher when the vitamin D is good, and adiponectin, it does protect not only against insulin resistance, but it does protect against atherosclerosis. So I did show data that vitamin D can be due to obesity, and vitamin D per se deficiency can lead to obesity. Now, can we postulate that all obese persons coming to your clinics should have measurement of vitamin D? Maybe the guidelines are not very clear, but one of the indications of measuring vitamin D is obesity in the Endocrine Society meeting. And if you want to measure vitamin D, it's better to measure 25-hydroxy because longer acting. And the definition is having normal between 30 and 100 nanogram. If you want to convert to nanomole, you have to multiply by 2.5. And if it is less than 30, it's not normal, but they have put less than 20 is deficient, and between 20 and 30 insufficient. But for me, less than 10 is very low, and less than 10 you have definitely to interfere. Between 20 and 30 is questionable whether to interfere by giving vitamin D or not. But remember that all the labs are measuring by ELISA and chemiluminescence, which is not very accurate actually. But if you want to do some research, it's better to use the mass spectroscopy with liquid chromatography. This is the gold standard. But in our lab, it's easier to use ELISA and chemiluminescence. At the end, if I want to convince you that vitamin D deficiency can lead to obesity, we need some therapeutic effect. And in this very interesting study, which was done in Milan, Italy, on 400 patients that were obese and vitamin D deficient. Obese and vitamin D deficient. It had been shown by giving them vitamin D, the weight loss was better, especially with higher doses. But remember, they were vitamin D deficient. However, very recent meta-analysis, which was published 2 weeks ago, this meta-analysis, they showed that definitely vitamin D deficiency associated with obesity. But they did show by analyzing several studies that there is no improvement of obesity by giving vitamin D. And this might be due to the variability of the studies, the different types of patients, the different types of vitamin D, the different doses. That's why, although meta-analysis, we do respect it very much, but it seems that this was not conclusive. Madam Chairman, Lady Chairman, and Mr. Chairman, let me conclude by saying definitely obesity is associated with vitamin D deficiency, especially the visceral obesity. Obesity per se can lead to vitamin deficiency, and the reverse is also true. Vitamin D deficiency can exacerbate obesity. Treatment of vitamin D deficient person with obesity might be helpful to help them to lose weight. And obese person, remember that we need to give them higher dose than non-obese. You remember that the data I've shown. And we have to remember that in our beloved country, sunny, Alexandria Governorate, we've got plenty of sun, but we have to enjoy the sun, not staying in such room. Of course, we cannot leave. But exposure to the sun whenever is possible is important for us. And I'm inviting you, all of you, almost a month later in the same place for our 21st conference, the Endocrinology Society of Egyptian Society of Endocrinology and Obesity. It will be in May, and all of you are invited to attend. We've got many speakers, national and international speakers. And allow me to thank again the organizer and thank the chairman, and thank you very much. شكرا.